Hello, this is Rafael Mazuz from Diligence Wound Care Global, here for part 2 with Dr. Mogan Naidu, the head of MediAsia Advanced Wound Center in beautiful Malaysia. Part 1, we discussed a bit about the overview in wound care and focused more on products, wound care products, advanced wound care therapies that are used and price points and how to sell them in developing markets such as here. Now in part 2, we're going to focus on wound care services, learn a bit more about how services are delivered, and also about your plans to expand your wound clinic to a state-of-the-art advanced wound care hospital, catering to Malaysians and medical tourists as well. So, Dr. Mogan, welcome back.
Yep, hi. How are you doing, man?
We're doing well. We're hanging in there.
Good.
So, maybe you could tell me a little bit about your services in your wound center. How do patients hear about you, and what are the alternatives if they don't get treated at MediAsia? Where do they go before you, or if for some reason they can't travel every time, where do they end up? Public, private? Talk about that interface a bit here in Malaysia.
Okay. So first of all, diabetic in wound care, Malaysia wound care, you're talking about specifically diabetic foot ulcers?
You can focus on all the wounds that you see. I know you see primarily DFU.
Okay.
Yeah?
So usually DFUs in Malaysia, patients usually goes for the nearest clinic, general practitioner clinic nearby their staying village or house. So that is the first encounter. So the general practitioner either do a good debridement or antibiotics for the initial treatment and settle the patients, or it may get worse. Just because there is no proper offloading, it could take some time after that. So then patient will eventually be referred to general hospital, the government hospital, for further treatment, because usually general practice in Malaysia, they are not allowed, or they are not ready to do for a major amputation or IND, which is risking their practice as a medical legal terms and all. So they avoid doing any major amputations or any surgeries. They rather refer to the nearest hospital or private hospital. So from there, patient will be going, those who have insurance, medical cards, they will go to the private hospital, and those don't have, which majority of them don't have a insurance card, they will fall off to the government hospital. So when they go these two extreme, one is the private paying, or maybe some patient who can pay cash, they also go to private. Okay, if they don't have medical card but they can pay cash, they go to private. They rarely go to government hospital. So those who go into government hospital is either poor or you don't have a medical card. So once you go to the general hospital, what happened to diabetic foot ulcers usually is it's amputated. Usually is amputated rather than salvaging, because the load of patients in the hospital is just a lot of patients and full most of the time, and surgical operation theatre are always full with other major cases. So there are lack of doctors and staffs to do the tedious tissue repair. So what happened is they rather cut it off than just making it to survive, okay, or salvage it. So that is the easier way how to do it. But in private, at the same time now, private hospitals are catering for international market. Especially in Penang, we are a hub of international tourism, medical tourism. So patients are coming from Brunei, coming from Indonesia, from Jakarta, from Philippines. So we are actually full house in Penang private hospital as well. So the particular surgeon can be very famous foot and ankle surgeon. We don't have many, but if that particular surgeon is famous, then he is full as same as the government hospital. So he himself don't have time to actually do the tedious tissue repairs and limb salvaging again.
So he's going to be looking for surgeries or procedures that he can do one time and send them home.
Yes.
And not this kind of weeks and weeks of treatment for chronic wound care.
Yes. So it becomes a sin. So this is two private, a private hospital and government hospital. On the other hand, you see Malaysians have a culture, have a culture of going to traditional healers. It can be a Chinese or Indian or Malay. All of us go for traditional healers first, because DFU is something recurrent. It can be a recurrent problem or it can be a chronic, prolonged problem. So many of them think that it is something to do with spirits, with somebody charming you. So what happened is all our major population here goes to traditional healers. See, my wound is not healing for 6 months. I think somebody has done something. I think the spirit is in my house. My business is going down. The wound is getting bigger and bigger. They amputate one toe. Now they amputate second toe.
What therapies would a traditional healer use here in Malaysia, for example?
Malaysia, they use many.
Is it topical things on the wound, or is it more just for the whole body and diet and stuff like that?
No. Usually, if they go for a wound, what I know from my patients, they tell me, I used to hear all these stories. They topically, they just
creams and stuff like that.
There's no creams. They probably use some plants. They grind the plants. I don't know what kind of plant it is. They put some seeds on it. They put some sesame seeds.
But it's not an alginate. That's for sure.
No, that's for sure. they put some pumpkin seeds. I've seen. And some using unsterile larvae as well as megatherapy, the larvae from the rubbish, So it is not sterile. It was last time. So what happened was, they don't know what they are doing, of course. Okay, so traditional healers, they go and spend money and spend time. Let's say about 2 to 3 weeks, and 2 to 3 weeks is enough to damage the whole foot, man. Yeah. So it's almost too late. So these extreme patients, another one goes to general practitioner or general hospital or private hospital. Okay, now the surgeon says, anywhere in this centers, they said, I have to amputate. They say, okay, no, I'm going to discharge, I'm going to get a second opinion. They go back to the traditional healer.
Oh, really?
How
do they get out of that cycle and back to you or to you?
Okay, so what happened was, now since we are here doing the surveys for 6 years, slowly people are getting to know us by word of mouth, by our success rate. People are knowing us through CMEs, through conferences. Practitioners are knowing us. They are starting to referring us patients. Our friends from the GP setups, they refer us cases, and then patient get to know through internet about our center and our success rate, looking at the pictures. This is how they actually get to know my center here in Penang. So most of them get to know slowly. It's not many. We don't advertise much because of the the space limitation in the current setup. So once we have the space, then we will probably advertise fully. So this is how patient actually escape either from the traditional healer or from a private hospital who states amputation, and they don't want amputation. They come to MediAsia. Sometimes they go to the general. Most of them from general hospital, because general hospital is for sure mostly 80% will amputate. So they will find the resources how to come to MediAsia. But what I'm saying is always, why not they come early even? Yeah.
Well, we just saw a patient in your clinic that it was his first time with you, and they had just discharged him from, I believe, a public hospital with oral antibiotics. Correct. And saying it's okay. And your colleague pulled out some infected bone, first metatarsal bone.
Yes.
Right, 10 seconds into the treatment.
See, this happened when you go to general hospital and the training doctors just graduated, coming for training and sitting up in a pose of being a houseman, or maybe just recently promoted to a medical officer in the orthopedic department. You just it is a small wound, just put some antibiotic and it'll be so. Failure of seeing the problems in diabetic foot ulcer.
And they're not using X-ray or any of this stuff to look for the osteo. No, nothing, none.
They're supposed to,
but
that is the right thing. Yeah, that's the right thing to do. But you see, again, the system, the system to do an X-ray, it takes hours. And then for you to get an appointment to do an X-ray, it takes hours. Or at least refer to the private hospital, private X-ray centers, right? To get an X-ray done and come back, but even that is not available. So this patient lucky came to us, and we told him that the bone is already going off. If he's just waited for another week, then it's another way for a get-to. So this is how actually patient come to us at a very late stage. Yeah, of course.
Okay, so your clinic right now, you have your main clinic here in Penang.
Yep.
And you have your associate clinics in Asia, in Malaysia, and in KL, as Kuala Lumpur.
Yep.
How many patients here in Penang do you see in a day on average?
Okay, on average, we see about 30 to 35 patients in the wound center by itself, and we have a diabetic care center at the first floor. So there we see about 10 to 15 patients who are chronic diabetes, hypertension and other metabolic problems to settle them out. So particularly the whole center sees about 40 to 45 patients a day
So you can actually help heal the wound, and then you can do follow-up diabetic care for
Yeah.
blood sugar management
Yeah.
and all of those
Yeah.
important things,
Correct.
screenings and all that.
Correct.
Very nice. So that's quite busy actually. Those volumes I'd say are on par with the top 5 or 10% of busy U.S. wound care centers.
Wow. Okay.
So that's quite impressive, and I understand that you're building. We actually toured the campus where you have the land,
Yep.
and you're building a private
Yep.
wound hospital.
Yep.
That's the
Correct.
plan.
Correct.
Can you tell us about that?
All right, we have a vision in MediAsia since 2012. In the beginning itself, that we want to build the first private full functioning hospital, a specialty hospital, a center of excellence for diabetic foot ulcers, especially and other complex wound. In Kulim, Kedah is another about just a 20 minutes drive from our clinic here now. So it's in the state of Kedah. It's near to the forest, so more fresh air. And we have purchased the land many years ago just for this project. So now it's time to set it up and let the project run. So the hospital actually is a vision, because we realize that even the private, the high 6-star or 5-star private centers, or the other hand the government centers or any other centers cannot cater fully for a diabetic foot ulcer especially, and everybody is just have one way, either amputation and amputation. Thank God if they got healed, but the recurrent rates is too high just because they don't have a proper footwear, proper advice on how to do after, how many steps to take, what kind of footwear you should use after that to prevent recurrent. So you heal a wound, but you fail to do the prevention for recurrence, and you're still subjecting patient for an amputation. Even though he healed now, he's so happy. After 6 months, he gets back a wound. After spending to you about 10,000-15,000 or 20,000, and he gets back a wound. So we feel that these patients need a proper center, a proper setup, a proper specialty hospital just for wound care for all Malaysian and also associate countries beside us, like Indonesia and Philippines. So we want to cater more people with more specialized doctors in working with us here, more multidisciplinary actions in the one building. We can do more for them. So that is why we want the center of excellence, so we can deliver the best in Southeast Asia and also probably the world. Show that we can do more than just advanced product alone and technology, but we also can do something with just simple, basic, and help many more to cure.
Very nice.
This is a model that we are doing.
So how many, on average, of course every patient is different, but on average, how many weeks as a patient in treatment under your care at MediAsia till they're healed?
Okay. Usually we screen the cases. As I told you yesterday, we screen the cases of. We are very committed to our screening patients before we take them for treatment. So what I do is we do a thorough investigation and talking to the family and all to accept a patient for treatment in MediAsia. So we want to know everything about them before they come into a treatment point, because we don't want them to halfway go off or just come for treatment for a week and then you don't come back for follow-up because you don't have money. So we don't want all that. So we screen. So what happened is patient through this we have a very highly successful rate of patient being for the whole treatment course. What actually you are asking me?
Yeah. Well, the weeks in treatment on average.
So on average, because we screen this kind of patient that we know is going to heal. So usually any complex diabetic foot ulcer or complex wound will take 3 months in average to fully heal. 3 months average. That's about 90 days.
So that's quite in line with averages, I think, in well-running, well-functioning wound care centers in the U.S. as well. About 12 weeks on average. You'll have patients that 100 weeks never heal, and you'll have patients 2 weeks healed. But on average, I think 12 is a very good line. So you guys are seeing quite high volume with full capacity. You have healing rates very, very in line with the top centers in the U.S. And now you're going to build this new hospital. What are some of the opportunities that you see? I mean, have you thought about business model for telemedicine? I mean, especially if you have all these patients coming from other countries as medical tourists, maybe they can't stay the 12 weeks. Do you have any ideas for maybe they come for 5 or 6 weeks until they get out of the red or yellow zone into green zone, that you can somehow stay involved in their care, but let them go back home or go back to another city that they live in?
Yeah, actually currently that is what we are actually doing, because we have an associate clinic in KL. Just because many of them are traveling from southern region of Malaysia, and I'm the HQ is in the north. So why the purpose of having an associate clinic in KL is because patients can go back to their hometown or is surrounding of Kuala Lumpur, Selangor State or Malacca. It is just nearby to Kuala Lumpur. They can travel 1 hour compared to coming here and staying at another place. So in that way, we are asking them to go back. And this same thing happened to patient coming from Jakarta or other places of Indonesia. Definitely they won't stay here for 3 months. So we want them to go back to their own environment, to their own home, to heal better rates. So we are actually looking into telemedicine, into teleconferencing with the doctors there, into associating with other doctors in around Malaysia, of course, surrounding Southeast Asia, to communicate effectively, to use a good communicating tools, device, to effectively do a treatment when they go back home, so that we can closely monitor them from here and be safe at all time, making sure that they heal at a given period of time, 3 months. Or so that we are actually doing that, and of course I need your expert opinion as well, in this particular field, because you are the best for this, man.
Well, thank you for that.
We are definitely looking into telemedicine. We are definitely looking into more advanced way of communicating with other doctors in other regions. We're definitely looking into it.
Beautiful, beautiful. Well, I'm very intrigued by this project, and I think it's going to be first of its kind. And I believe it's a huge opportunity in the region. So, for my healthcare and medical investor audience and connections who are going to be listening to this, final question or final statement from you. I want to give you the opportunity to make the case about wound care in Malaysia, or as you said, in Southeast Asia as a whole. Why would this be a good investment to invest in MediAsia's new wound care hospital facility, in terms of the opportunities for treating wounds and the demand and all of the other things that they should think about this, and not just about opening a cardiac center, opening a mother and baby center, opening a spine center. Why should they consider advanced wound care service line as an investment?
In Malaysia?
Yes.
Yep. Okay, see, as what I told before, we are the only private fully operating center in the whole country, having a full setup of operation theaters and podiatrists and rehab specialists, with a diabetic center and with all facilities. So we are the only one now. So what I'm saying is, we have actually no competitors in this business line as a full service line here. So that is one. Number two, even private centers could not solve diabetic foot ulcers. Even though you have insurance card or you have millions in your pocket, they still can't close a wound. That is because the time factor, the surgeon's time factor to treat the wound, as I said. And a different way, if you go to general hospital paying less and you still get amputated. Whereas you go to general practice, it's not an environment for you to heal a wound. So where are you going to go? So there's no way to go anywhere. So the best way is to have a private center here in Malaysia, and is a center of excellence that everybody going to know, and it's a niche market. Advanced wound can not many practitioners want to deal with nasty, smelly wounds and pus and fungating wounds, and and the staff is not easily, because Malaysia, as such, people don't like all these nasty things by right, In nature, they don't like bad smell. They feel the wound is ugly, and to get staffing for this is very difficult. So why I think the private center, the first one, should be here is because we have all the resources, correct? So why you should invest in Malaysia is because diabetic foot ulcers is everywhere. Our food is good, right? Our food is good, and we have restaurants open 24 hours a day.
I think you have the highest diabetes rate here in all of Southeast Asia. It's like something 25% or something.
Yeah, so 25% of the population, and many more to come, because of the industry of food industry in Malaysia is so good. So there is no chance of them of lacking of patients. We are always having patients. It's just that to accommodate them and to have the personnel to treat, to have the amount of doctors and nurses and paramedics to help us in a bigger center to do it. So we just don't have that. So if we have the more capacity, then we'll we'll make it full. So another point is Indonesia don't have an advanced wound care center like what I'm talking. Of course, they have in a private center by themselves in a private hospital. It's going to be the same. So Thailand have, but they have it in Bangkok, but not in Hanyai, not in the southern Pattaya. They don't have. Sabah Sarawak don't have an advanced wound center, private. Brunei don't have one. Singapore has, but not many from other country going to Singapore, because Singapore currency rate is higher than the other surrounding countries. So they rather come to Malaysia because it's almost the same.
So it sounds like you're potentially the best set up, the company in the best position to offer this service in a radius of maybe 300 or 400 million population here in this part of the world.
Yeah. Yes.
Very, very interesting.
Currently, what happening is patients are going to India to get the advanced wound therapy done, and many of them go to India, which is 3.5 hours in flight, and they don't know anybody there. Sometimes problem with food and place you stay and communication. They end up with amputation. How many months can you stay in Indonesia? I mean, in India, correct? You can stay about a month or 2 months, then you have to come back. So who's going to follow up you here? So the best part is we are here, and it's enough of Malaysian itself. Our patient is too much to handle compared to the surrounding countries. If we want to do that, then we've got to do 3 or 4 stories of building and having about 10 to 15 doctors working at the same time to get the output. Yeah.
Wow. So
and people are willing to pay cash. Because patients from international, Indonesia, Philippines, Thailand, they can't use insurance here. So if they are coming like how they are coming now, they're bringing cash. Even Malaysian, many of them, I said, they don't have medical card, so they are paying cash. So cash flow is there daily.
Even me living in the U.S., I stopped my dental insurance. Now I just get my teeth cleaned and everything here in Asia. It's just much cheaper, and I think the quality of care is even better, to be honest with you.
Yep.
Yeah. Well, massive opportunity, Dr. Mogan. Thank you so much for sharing with us. I'm
No
sure
problem.
a lot of people will be very interested and happy to put you guys in contact.
Sure.
To discuss more. If people want to learn more, they can send me a message at Diligence Wound Care Global. That's diligencewcg.com. diligencewcg.com to learn more about this and other global wound care investment opportunities. So thank you very much for your time, and looking forward to visiting you again in the near future.
Sure.
Thank you, Doctor.
Thank you so much.